a world-renowned author's worst nightmare. This is Kenya News Update today. Coming up, you'll discover how a simple hospital visit turned tragic for one of Nigeria's most celebrated voices, and what it reveals about a healthcare system on the brink. Meet Chimamanda Ngozi Adichie, acclaimed novelist, global icon, mother. On January 6th, her life shattered. Her 21-month-old son, Nkanu Nnamdi, died in a Lagos hospital. But here's the twist. This isn't just a private tragedy, it's a public indictment, and the family is fighting back with a legal notice that could change everything. Nkanu was one of twin boys born via surrogacy in 2024. He fell briefly ill. He was at Euracare, a private hospital in Lagos, for diagnostic procedures, an echocardiogram, a brain MRI, routine until it wasn't. The family had already arranged a medical evacuation to Johns Hopkins Hospital in Baltimore for the very next day. But Nkanu never made that flight. In a leaked WhatsApp message, Adichie describes a living nightmare. She accuses the hospital of negligence. She says a doctor told her directly that the resident anesthesiologist administered an overdose of propofol, a powerful sedative, that the doctor was, in her words, fatally casual and careless. Despite resuscitation attempts and a ventilator, Nkanu suffered a cardiac arrest. He was gone. But here's what nobody's talking about: the legal bombshell. Lawyers for Adichie and her husband, Dr. Avara Essage, served Euracare with a formal notice. They demanded CCTV footage, electronic monitoring data, and the toddler's full medical records within 7 days. The notice alleges critical lapses during admission and a shocking lack of basic resuscitation equipment. The hospital's response? They deny negligence, saying staff provided care according to established protocols for a critically ill child. They haven't yet replied to the legal notice. This story has triggered a national outpouring. Condolences flooded in, including from President Bola Tinubu. The Lagos state government called it a profound tragedy and ordered an investigation. But zoom out, and this case hits a raw nerve in Nigeria. Doctor-to-patient ratio is an abysmal one to over 9,000. Less than 5% of the national budget goes to health. Botched procedures are common. Emergency services are sparse. Remember when boxer Anthony Joshua survived a crash that killed his friends? He was lifted into a police truck by pedestrians, not an ambulance. This is the reality. Medical tourism has become the escape hatch for the wealthy and powerful. But for most Nigerians, that's not an option. The tension is clear. A grieving family seeks answers and accountability. A hospital defends its standards. A nation watches, asking if this could happen to anyone. But if the allegations are true, what does that say about the safety of private care? And if they're not, what explains a child's death on the eve of evacuation? Do you think this legal fight will force real change in Nigeria's healthcare system, or will it be another tragic story forgotten? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking news that matters.